All right, but I'll get us started for sure, and just kind of give a brief introduction about what we're doing here at USM and kind of what my focus was for this presentation. When Bridget asked me to do it, I wasn't real sure what my focus was going to be. To be real honest, I wasn't really 100% sure until yesterday. I kept thinking about like what I was going to talk about and how I was going to integrate something that you guys could learn from, while also making sure that we were kind of talking about what we were doing at USM, what is a health coach, kind of both worlds. So let's get started. Here we go. So I know that as kinesiotherapists, we are absolutely experts in therapeutic exercise. We know a lot about basic health, basic fitness, nutrition. However, we're not always experts in effective communication. I think that that's one thing that I found with a lot of when students graduate, they start to, get jobs and that kind of thing. And I think one of the things that we're often missing is some effective communication strategies. And as I started to talk with the guys at ACE about some of the options that they had for credentialing and stuff, health coaching kind of kept coming back. And we know that that's kind of the buzz term that keeps coming back and back. And I wasn't real sure how we were going to use that, how we were going to integrate it. And I really wasn't sure if we really needed it. But I've really learned a lot about how communication was really kind of the key backbones of this health coaching stuff. And one of the things that I can see KT's doing is adding these strategies into your practice. And what we hope to find is that it'll not only increase client retention, but really looking at improving outcomes. And then if you're really interested, maybe you can even attract new clients if that's kind of the focus. So let's talk about it. What I want to do, and on the screen there, you can see our learning objectives for today. We're going to talk about health coaching and what health coaching really is. And then I'm hoping to describe some of the ways that you could use some techniques in your KT practice and give you some real like things you can take home with you. And then the very end, I'm going to look at different health coaching certifications. I did a little Google searching and found some different ones. I will be 100% upfront. My health coaching information, certification, everything I really know about health coaching does come from the ACE credential. Over the summer, I actually also participated in a specialist course in the behavior change specialist. And so all of my background is really from ACE, but I did learn a good bit on my Google searching, and I'll kind of share some of that with you guys to see if there's another coaching certification that's out there, but I'll give you some tips on, which ones are obviously more accredited and better than the others. So what I wanted us to do first is here on your screen, you've got a Slido, and I use these Slidos in class, so my students will definitely be real familiar with how to use it. But if you've got your phone out, you can scan the QR code at the top there, and it'll bring you to this poll. If you don't have that and you've got computer access, you can go to slido.com and type in this code right there. And when you type it in, what I want you guys to do is just when you hear the words health coach, really what first comes to mind. And I wanted to see kind of where we all were with our health coach language before I continued. So if you're just joining us, I know a couple of folks just logged in. We are participating in kind of an introduction. It's a Slido. If you scan the QR code, you can provide the answer to this question, but it says, when you hear the words health coach, what first comes to mind? Regina, I see your comment in their chat box. I think that that's what my students would agree with you as they are on their journey to becoming health coaches. They're certainly feeling that way. So as we finish our Slido here, I'll tell you a little bit about what we've done here at USM and kind of where a lot of this health coaching stuff has gone. But here at USM, we are now requiring that students take a health coaching course. So in addition to all their therapeutic exercise and exercise phys and kinesiology and all that kind of great stuff, they're also taking a course in health coaching. I use the ACE credential and I use the ACE textbook and all that kind of stuff to kind of drive the course. And so one of the things that we'll discuss a little bit is, what their thoughts are on that and how they are at, getting excited about this health coaching thing too, and kind of why we added it. So as we finished up our Slido here, you can see on our word cloud that accountability partner is really kind of the key. And you guys are certainly absolutely on the right track of kind of the idea about a health coach. And it's really one of the things that I wanted to talk about was kind of at first, what a health coach is not. And so a health coach is not, a doctor, it's not a kinesiotherapist, not a physical therapist, it's not a psychiatrist, it's not a counselor necessarily. It's definitely not a nutritionist or an exercise professional. It really is that accountability partner that you guys discussed, right? A cheerleader, a guide, certainly absolutely not a leader. And so through my studies and through everything that we've been doing here at USM, I can really see a health coach can use that health coach model and use a lot of the health coach information, certainly more on the communication side of things. While we are, therapeutic exercise experts and we have some basic nutrition knowledge, I think that sometimes I see where we could use some motivational interviewing techniques to really grow our practice and really talk about client retention. That's really where I see a lot of it. We've all had difficult clients. One that seems that no matter what we tell them to do, they're just not compliant. They're just not doing it. And they're just not, keeping the instructions. They're really reluctant. They're really making that as a real barrier to their goals. And maybe what we can look at is using some of these techniques. Having them in your toolbox will help you be able to better prepare your client for what's to come. And so let's talk about motivational interviewing as the kind of the primary technique here. And I'll show you guys, I'll give you guys some tips on, what that really looks like, how you could use it in your clinic. So motivational interviewing is essentially a collaborative, goal-oriented style of communication. Really what we're looking at is the attention to change, status quo. We talk about kind of designing and strengthening personal motivation for commitment to a specific goal and helping our clients to be kind of in charge. One of the big true spirits of motivational interviewing is being able to respect a patient's autonomy. They're in charge of what they're supposed to do, and that you and your client really share the driver's seat. And it's more about the client's decision to ensure that or maybe more about it's your job to make sure that your programming is really client-centered and that a client-centered approach is really the goal and the aim of your program. So does it work? Golly, research would tell you that it does. I've pulled out just three bits of research that look at motivational interviewing and some type of other intervention, and really wanted to talk to you guys about, kind of that proof, right? So the very first study up there looks at motivational interviewing alongside of traditional physical therapy. So they conducted a 14-week study. They used about 100 participants, then they split those 100 participants into two groups, 50 on each group. They were pretty even by gender. They were pretty, average age was about 50 years of age. And they found that the group that received the motivational interviewing alongside of the traditional physical therapy had significantly lower pain scores. They had higher functional status. But I think really most importantly for me when reading this is that they had much higher exercise compliance. So they came to physical therapy more often, and they also did their exercises at home that they were supposed to do. So kind of a big double whammy there. The second one on the list was a little bit different. It was a nursing study, so kind of not along the same lines as the top one or the last one, but they were nurses, and the nurses used motivational interviewing techniques alongside of like check-ins on the phone. And what they were looking at is to improve diabetes outcomes. So they split the groups. One received motivational interviewing monthly sessions, and the other one just received regular phone calls. What's your A1C levels? And so during the biweekly calls, the nurses would review the client's glucose levels, their A1C levels, and talk to them about certain lifestyle factors. Are you doing physical activity? What's your diet look like? That kind of stuff. And those that received the motivational interviewing intervention had significantly lower A1C levels. And even more importantly, they also had better, their BMI improved. They lost weight. So not only did their, A1C levels lower, but they weren't on an exercise program. They weren't supposed to be doing an exercise program, but they lost weight because of just this interviewing technique. And so in the very last one on the list, this group just did interviews. All right, so they interviewed 200 people that were considered to be moderately active or inactive at the time of hospital discharge. And the participants received a very brief motivational interviewing behavior change intervention about 5 days after they were discharged from the hospital. And then they did a 2-week follow-up post the initial intervention. And what they found was that 100% of the 200 really said that they were going to participate in some type of physical activity program after the motivational interview. And then 66% of those people reported that they had participated in the physical activity 2 weeks post. So, golly, so does it work? I think so. There are several other research studies out there. There are a lot of literature reviews and stuff like that too. Lots of review stuff from previous 2015 data. But I think that that's something that's really powerful to talk about how you could just include just a little bit of change into the way that you approach a client, talk to a client, that could really change the outcome of your overall sessions. So that's really my primary focus for today, is to kind of talk about some different ones of those techniques and see if you guys can, if you're not already utilizing some of these, you could start utilizing them. If you are, as Regina, I'm looking at her comment there, she says health coaching is a lot of talking. And absolutely a lot of talking and a lot of listening. But I think that one of the things that I've learned and really take with me a lot is that fourth one down there. I'm going to talk a little bit about it. It's called the writing reflex. And the writing reflex is that we are the authority, right? We know what we're doing. We know that what we are doing is going to work for you. Just do it. Dadgum. But people can't. Y'all know all those clients that that aren't as receptive to change as you would hope. So pros and cons. So let's talk about, there's 5 techniques on our screen here, and we're going to break down all 5 of them with a little bit of tidbit information. So if you can incorporate 1 or 2 of these things into your practice, then you'll see how it goes. All right, so how does it work? The first thing on my list is, and I've taken a lot of motivational interviewing stuff and kind of squished it together. I've taken even just a couple of health coach things and kind of put these on these 5 tips. A motivational interviewing occurs in 4 steps. But not, this first one's not really in that motivational interviewing tips. And I think that that's something that's worthy of a good conversation. It's about meeting the clients where they are in the behavior change continuum. So I know that all of my students that are present here on this call, and I also know that Dr. Burwell's students, I know you guys all go through the trans-theoretical model of behavior change and really kind of delve into that. And I hope we don't forget that in real practice, because we know that there's some very simple techniques that we can use if we just kind of meet clients where they are. One of the rules really looks at those that are in pre-contemplation. You know, if y'all remember, our pre-contemplators are those that have absolutely no desire to change. They don't think that this is going to work. They can't make it work. And so what we are going to try to write them, right? We're going to try to say, hey, look, you've got to do this. Your doctor said you had to come. I don't care what you do, as long as you do whatever I tell you to do. And maybe some different ways to approach that might be to give them some type of self-assessment. You know, so one of the techniques of a pre-contemplator is to give them some type of self-assessment. Well, you know, could you think you could do something differently? And it's not really anything, you know, not time off yours, and maybe might be an opportunity to help our clients grow a little bit. So another one that's on my list is about somebody that's in contemplation, which I think probably we have a lot more of contemplators, probably not as many in preparation, but those that are in contemplation, right? And that contemplation stage is that they know that they need to make a change. They want to make a change, but they just have a lot of excuses. They got a lot of barriers, a lot of reasons not to. And so one of the techniques we talk about a lot is helping them make a pros and cons list. They make the list. They decide what's good about exercise, what's not good about exercise or physical activity or whatever your focus really is. And then they make a list of, you know, pros and cons. Should I do it? Should I not do it? Why not? And then you had to help them weigh those results. So meeting a client where they are could just be, you know, eye-opening to them. Hey, you know, maybe I do want to do this. Maybe I won't be so resistant. We all know that we've got clients that come in, they're just maybe mad that their doctor sent them and they didn't give them the drug therapy they wanted or the surgery they wanted or whatever that might be. And so this is a technique and a way to help them find where they are. Other things is about open-ended questions. And Regina, I see your comment about open-ended questions, but absolutely asking a lot of open-ended questions is really, really going to be the key. And this is one of the things that my students that are here today from the health coaching course, this is one of the things that we've been talking about a lot. It's a lot of open-ended questions. So when practicing motivational interviewing, about 70% of the questions need to be open-ended. So closed questions, you know, your example is, oh, I got an example on my list. I'll make sure to stick to the script. But open-ended questions is one that keeps the conversation going and makes the patient think about their answer instead of answering reflectively. Especially when dealing with a high emotionally charged interaction, an open-ended question can be a lifesaver. When a person is emotionally charged, they can be mainly operating from an emotional center in their brain. And by asking an open-ended question, the patient has to stop, think about the answer, and that can bring them to a higher brain center, back online, back calm, and maybe at least distract them from that negative emotion. So a good open-ended question can focus the conversation on something that's more positive. So instead of asking things like, do you like to exercise? You could ask, tell me what your previous exercise experiences are. And that would be a great kind of example of utilizing some type of open-ended questions. Let me refer back to the chat here. I saw some couple of great messages about the chat. Open-ended questions might maybe last a long time, but they helps your client to feel heard. And that way you're creating that bond and that relationship there. Terry says, mental has to go along with physical. Absolutely. And changing mindset and reframing the way that they think sometimes doesn't have to be an overwhelming process. Yeah, absolutely. So the next one on my list is about affirmations. And somebody said affirmations on our very first slide there. Offering many different affirmations can absolutely increase self-efficacy, and increasing our client self-efficacy is, again, one of those things that we're talking about, giving them choice, giving them the opportunity to be successful, and really ultimately retention, right? Retention and outcomes, that's really the key. So affirmations are the way to identify and acknowledge someone's strengths, what they bring to the situation. The focus is on behavior or value more than attitude or decisions. An affirmation is a different type of compliment, right? A compliment is like, yeah, I love those shoes. Those are awesome. But a good affirmation would be something like, you demonstrate a lot of perseverance to keep showing up to treatments despite all of the challenges that you have going on in your life right now. That's a good affirmation. It's not a attaboy necessarily, but it's giving some details about you understand where they are, you understand that they've worked hard, and you understand that there's some challenges that are going on. So a well-timed, quality affirmation can assist with promoting change talk rather than sustained talk. So our change talk, I'm going to make the behavior, I'm going to change my attitude, I'm going to participate, rather than sustained talk, which is more like, man, this is boring. I don't like this. I don't want to keep coming to do this. This is not doing me any good. A good affirmation can also change your client's mood. If they're feeling powerless, they're feeling down, they're feeling depressed, a good placed affirmation can turn that frown upside down. Cheesy. The other thing that we talked about earlier was about refraining from the writing reflex. So the writing reflex is all about, let me give you the advice. I asked you an open-ended question and you told me what your problems were, so I'm going to try to solve them. Oh, let me give you some advice on how to write that problem. Instead of using writing reflexes, a better idea would be using reflections. And so that's part of these motivational interviewing techniques, is to use reflections. And reflections essentially are ways to ensure that the patient feels heard. The clinician can ensure that he or she heard the patient correctly. So your reflections are just kind of, there's different types. We talk about 4 or 5 different ways that you can use a reflective statement, but one of the ones you could use is just a direct reflection. It's called a simple reflection. And a simple reflection is just simply repeating back to your client what you heard them say. In a good motivational interviewing practice, there's about a 3-to-1 ratio of open-ended questions to a reflection. So you might ask 2 or 3 questions, give a good reflection, ask 2 or 3 more, that kind of thing, rather than trying to be the authority in the situation. And so the goal essentially of our reflections is to help them, comment back to them sometimes in different words, There is a couple of different types. I think I said that earlier about reflections, but a simple reflection is just, right back at them exactly what they said. More of a complex reflection would be maybe making an inference. I think this is what you said. I think this is what you meant. Let me reflect that back on you. And then that's correct. Great. We can continue our conversation. But if that's not what you meant, then we can further clarify. And that way you're not just trying to give them a bunch of advice. Reflections can also help you dig a little deeper, to take a guess at their underlying feelings, right? The meaning of their statements. And then my last technique here is about letting the client be in charge. They're absolutely in charge of their own destiny. They're in charge of whether or not they get better. They're in charge of whether or not they're successful or not. And we get the clients past these certain barriers and we get them motivated. We can focus our rehab techniques and hopefully have much better outcomes. And that's really kind of the goal of our different techniques there, is to making sure that we are letting our clients choose what kind of exercises they want to do. I saw, when I was doing my research for this, I saw a kind of a funny video. I guess it wasn't funny, but it was just a video. It was kind of plagued to be funny, but it was therapist comes in, client comes in, and the therapist asks, what do you want to do today? And the client says, I want to take a nap. And so the therapist says, all right, well, we're going to come lay down over here on the treatment table, and you're going to nap, and I'm going to do some passive range of motion exercises. All right, so that's probably not their overall overreaching goal for the day, but it's golly, the client felt in charge, and I think the session continued on, and so it was kind of a positive spin on letting the client be in charge. So, as kind of more of a global look at this, when we're talking about what benefits does health coaching certification have to you individually as a KT, we're talking about communication skills. We talked about helping our clients increase their self-efficacy through some of these different techniques. I just spoke to you guys about motivational interviewing, but there are definitely other techniques that are within the health coach scope that you could utilize to help your clients feel like they're in control and that they can continue to participate in the therapy, the activity, whatever that might be. And then, of course, they can continue on outside of your therapy practice. They can continue on to be successful in whatever that change might look like. Of course, obviously, we want to have improved outcomes. The other thing that I was thinking about as far as benefits for a KT as more of a professional, not encompassing it necessarily right in, but you guys in the VA know about the whole health initiative, of course, and I don't need to speak to that. But there is kind of this global health coaching buzz term as more of a professional level. If you could add that to your toolbox, not only in your therapy practice, but maybe as an additional types of certification. Another reason that we added that to our curriculum is so that our students can now sit for this health coaching exam. I'm still working with ACE and getting them able to sit for it before they graduate, but right after they graduate, they're eligible and ready to sit for this exam without having to study extra for it or anything like that, and pay extra for the study things, which we'll get to next. But that way that they can kind of have these additional certifications on top of the KT certification. Now they can have the health coach certification, and it makes them more marketable within their, everything. So I got this chart many years ago. Cedric Bryant, the the CEO from ACE, came to talk to us at the annual conference about what health coaching looked like and how KTs can add that into their practice. So I 100% stole this entire chart from his presentation. So I will definitely give him credit. But I think that this was one of the things that struck me as one of the biggest reasons for kind of adding this model into what we do. So our traditional healthcare model, the health profession is the experts. We absolutely know the best. And, obviously we've, taken all the courses and we've done all the previous experiences, and all that stuff is absolutely true. But one of the things that we know that people don't like to be told what to do. If we think that we've made our own decisions and we think that we are the experts in our own lives, we often want to talk about what our barriers are and the reasons to not do something. So the health coaching model helps explore all of those reasons to not do something, helping our clients realize that perhaps maybe I can do it. I might want to do it. And so other things on this list talk about how it's one-on-one solution, which I think a lot of KTs, we use that as an individualized exercise programming pretty regularly. But kind of letting the client be in charge of that would be the harder part. Helping to do that, though, helps them develop some intrinsic motivators from within. I'm feeling so good about this. I want to continue. Here are the reasons why. And we know that once our clients realize those intrinsic motivators, they are often much more compliant and will certainly increase their outcomes and will ultimately be much more successful. And then we talked about resistance to change, addressing different barriers, making sure that you are that cheerleader, right? You're the assister, you're the collaborator, you're the helper. And we might, require a little bit more effort a lot of times, but certainly will help in a lot of retention efforts. All right, so some of the last things that and I see you guys are offering up some good stuff right here, so I can't wait to read it. But I just want to talk about some different certifications that are out there. I did a couple of internet searches. I said that earlier. I looked at a couple of different lists. This one is on verywellfit.com. There's another list that was on mbghealth.com. I also looked at some various other certifications that are out there. And so these top 8, we were looking at, there are some that are health coach programs, not that I think that's what you guys probably don't need to go back and get another bachelor's degree in health coaching, but that is an opportunity that's out there. I noticed that Delgado Community College down in New Orleans is offering one. Emory University is offering one. The one through the one through Emory is continuing education, and the one through Duke is a bachelor's degree program. So this is just another avenue that's out there for sure. So the ones that kind of lined up through both of these programs were these 4. So in all of these programs, I checked to make sure they are all listed on the National Board of Health and Wellness Coaches. And so that National Board of Health and Wellness Coaches is essentially an accrediting body for different health coaching certifications. There are a lot of them on the list. All 4 of these are on the list. The other thing that sets ACE apart, though, and I could not find that on any of these 4, there may be another one on some of the other ones that is a good bit or is also NCCA accredited. So the ACE exam is also NCCA accredited. So that kind of makes it a little bit different from some of the ones on the list. I did also look at price range and cost. And we go back, I'll show you guys my list again here on both from wellfit.com and from MBG Health. Both of those alluded to the fact that the ACE certification was the most affordable option. And so when I researched these four right here, that was absolutely the case. The ACE certification, along with the study package, is about $700. There's other options. You could just take the exam, sit for a couple of practice exams. That's what my students are going to do. At the end of their plan, they have the opportunity to just take the exam, maybe a couple of practice exams, but just take the exam itself. That $700 also includes the textbook and things like that too. But some of the other ones are upwards range of $7,000, $10,000, which some of those bachelor's degree programs are those that are a little bit higher. But even some of these that are on this particular list right here are a little bit higher range. So absolutely do your own research on that. I did find that the very first one on that, the lady who wrote about the WellFit, I did notice that she was a personal trainer from ACE, but that she had this Institute of Integrative Nutrition as her health coach certification. So did a little bit of things. All right, so I'm going to go and I'm going to answer some of the questions on the chat first, and then I've got a follow-up question for everybody. So let me pull over here and let's talk about some of the things that you guys are talking about in the chat, because I think those are often very valuable. Oh, there's lots of hearts on here too. All right, so Terry says, clients absolutely have to hear positive statements from you. Absolutely. I mean, everybody likes to hear positive statements too. I mean, I like to hear positive statements every now and again too, right? But absolutely in the middle of your practice, and not just something that's generic or not just something that's not really identifiable to absolutely your client, right? And your reflections and your affirmations have to kind of align with exactly what they're saying. It can't be something like, I heard you. I will pick on one of my students from class the other day who we were asking what reflective statements were, and they made an acknowledgement of some kind of two-word statement. And it was like, no, that's not going to be a good reflection. Our reflections can't be something that's generic that we said to every other client that's walked in the door. They've got to be something that is more personalized and affirming, right? So that's kind of the idea. Oh, Lauren says definitely, absolutely a very useful tool. And you guys can absolutely, I'll be happy. I'm going to show you guys my reference list, but you can find a ton of stuff on motivational interviewing. I did find it really interesting to find those that were really hit it with OT and PT. I think that those kind of obviously are things that align a little better with our practice. But I think that one of the other things that I also found was that that nursing is really utilizing this a lot. And so we can also use a lot of the statements that nursing's aligning with too. Clients being in charge. Terry says she learned the hard way that just because I had a plan for them, it may be a million miles away of what they expected to do, what they wanted to do. I know you didn't say that, but and then if we're in charge, Terry says it can actually feel like bullying. I'm 100% on with you. Dr. Burwell, we did remove something from the curriculum to add the health coaching course. We removed a strength and conditioning course, which was in addition to, so we kind of had two strength and conditioning courses. And so we just removed one of those to add the health coaching course. And it's worked out just fine. Our students aren't strength and conditioning coaches, so it worked out good. Yeah, absolutely. All right, so I've got a follow-up question for you guys. So I got another Slido. So scan our QR code and answer my multiple choice question here. Which of the following best describes the relationship of a health coach and a client? Will everyone get settled in? There's one more thing in the chat I did not see yet. Let me see. Regina says, last one, act under the direction of the client. Absolutely. All right, so our, actually, the correct response was health coaches are equal partners with their clients, and that we might act under the direction of our clients, yes, but we are certainly equal partners, and we'll absolutely not always the authority figure, right? And we're certainly not the gatekeepers. We're not going to keep our clients from being able to do anything, but I do also think that there is a lot of truth to acting under the direction of our clients, but not always, not 100%. They're not always the authority and not always in control of everything. So yeah, there you go. You guys have corrected your responses, and we are now on the right track. Either way, I think you guys were on the right track the first. All right, so we are the therapeutic experts. We are certainly the natural extension of the healthcare team. But we absolutely know a lot about health and fitness and that kind of stuff, but do we really know how to effectively communicate with our clients to help them make change? And so I hope that you guys can use one of these techniques to help your clients make some type of behavior change, or just keep them coming back to therapy. Golly, that's the hard part, right? Use some open-ended questions. Give them some real honest affirmations. Give them some real honest reflections. And hopefully you guys will see some outcomes and some good results. I'm happy to talk about any more about the ACE certification, what we're doing here at USM as far as the ACE certification is concerned. But that does conclude what I have for you guys today. Here is my reference slide, though. I know that it's got a few things on it, 3 of those really good studies that were out there, and then I also have the different websites that I used for looking at those certifications. And then I, of course, have the ACE textbook in there too. Oh, yeah. Yeah, Dr. Burwell, I can send it to you. I'd be happy to send you my PowerPoint for wherever you want to use it for. All right, so any other questions, comments, concerns from the... Thanks, Terry. It's good to see you, even if it's just on here.
This was awesome. I don't want to take away from any questions if there are any, but thank you. Really, really interesting. And we will have this up on the website. So anybody that missed it or wants to go back to the beginning or write down some other notes, you can go back and review it again.
Yeah, Kathy, I'm getting a lot of yays, but no questions as of yet.
Well, hey, yays are good. We'll take them.
Well, seeing none and hearing none.
Thank you so much. What's next for you? USM has spring break coming up.
Yeah. Woo.
That's
next,
exciting.
I got to give an exam. I got to give an exam in 45 minutes.
Go. Thank you so much. You're the best. Really, really appreciate it.
Bye, guys.
Bye-bye.